This portion of Local Lifestyles is sponsored by Westside Chiropractic.
We are back with Dr. Jessica Ignacio of Westside Chiropractic, and the topic today might surprise some of you who are watching. We think about treatment of the spine, we think about people with injuries, and some people that just need to get adjusted, but we wouldn't think about pregnancy in a pregnant woman.
Right.
Certainly would need the adjustment, having been down that road before.
Yeah,
but
absolutely.
I wouldn't have thought at that time in my life to come to you.
And a lot of people don't. The mothers that think of me and think of chiropractic during pregnancy is usually baby number 2.
Because they've been down that road,
yes,
right?
And they were like, I don't know, like I have really bad sciatic, or if they've already been a current patient and I've been treating them and they become pregnant. And then I speak to them about the benefits and the importance of course, the adjustments during pregnancy. The benefits is the big word. And that's why I explained, first and foremost, I tell all mothers, it's completely safe, of course, and encouraged by a lot of OBs now to get adjusted because they're understanding the importance, and the pelvic health therapy part is also important to all, because it's all coordinated. And the most important thing is to keep everything moving. So underneath structure-wise, chiropractically, that is my job, is to keep motion throughout the spine.
Right.
So, of course, the pelvis. As we know, when you become pregnant, even in the first trimester, first couple of months, you don't really notice that much of a change. But when that second trimester hits, you're really starting to notice a lot of things because baby really hits a growth spurt. Well, then the pelvis, the body's smart. The body knows, and it's like, okay, something's different, but the body also knows we need to start preparing. So pelvis starts shifting, back starts shifting because it's going to make room for what they know is about to come. So when all that shifts, that puts a lot of stress on that lower back. 3 big things really. One is that sciatic nerve. So of course that sciatic nerve, I always talk about it. It comes from that low back. We all know that feeling, pregnant or not.
Right.
We know that sensation. It's that burning, numbness, tingling down the back of the legs. And that's because your sciatic nerve is being pinched by something in here. Of course, being pregnant, that puts a lot of stress on that lower back, sciatic pain. Chiropractic can really help, of course, to prevent that from taking place. The other big one, which a lot of pregnant mothers can relate to, is I can prevent them from getting that waddle effect that I talk about.
I was going to say, it's the mama walk.
It's the mama walk.
And then, of course, that throws everything out.
Everything.
I mean, you can't help it. You've got this big beach ball that has some weight in front of you.
Yep, and so it's not so much, yes, your center of gravity becomes off, but that's not why they waddle. They waddle because our pelvis joint looks like this on both sides, and that's what has us walk. Well, obviously, when that belly gets bigger and it pulls on that back, that pelvis starts locking up. So when that pelvis locks up, it's not doing this anymore, but they literally are doing this.
From side to side, yeah.
Yes. So then with the adjustments, the safe adjustments, we adjust that pelvis, we keep that motion in there, it prevents that. And of course, long-term effect with doing that, prevents inflammation, prevents pain. And I've heard lots of mothers who said that when they've been getting adjusted, pregnancy isn't as terrible, still painful, of course, but it's not as terrible in recovery time. They're not as sore afterwards because their back has been doing that motion and it's being prepared.
Well, I would imagine it also helps in delivery.
Yes.
I mean, if everything is adjusted, then you're going to be able to do your job without...
Because again, just remember, as the pregnancy becomes further along, especially 8-9 months, your back's already preparing for pregnancy. Right. So my job is to make sure it doesn't get too far out of line during that preparation process. And then it's really, moms always ask me, when can I come back in? It just depends. C-section, I always tell them, wait a little bit until you can lay on your belly, until you're comfortable. If you still can't turn because of C-section, we can still do upper back and neck. But I've had moms, not kidding, vaginal birth, they come in 2 days later. They're ready to get adjusted and feeling better.
Well, that's why we come to the pros.
Oh, of course.
Westside Chiropractic. We'll be back with more lifestyles right after this.
This portion of Local Lifestyles is sponsored by Westside Chiropractic.